On today's segment on what's going on with Parkinson's, we have James, 62-year-old male, who got diagnosed with Parkinson's 3 years ago. He is married to his wife and he has 2 sons. He and his wife are very active in their community. They go to church, they exercise, they do all that jazz. Until James, his Parkinson's progressed and it got worse, and now he doesn't want to do his ADLs anymore, and his activities anymore, and he also needs assistance doing them. So to tell you more about Parkinson's disease, we're going to go to Demi.
Parkinson's is one of the most common neurodisorders affecting 1% of the population greater than 60 years old in the United States. In the United States, 1 million people are diagnosed with living with Parkinson's disorder, and an estimated 4% of people are diagnosed with this disorder before the age of 50 years old. It is more common in men with a 3-to-2 ratio when compared to women. It is also 2 times higher in whites than compared to blacks and Asians. It is also 2 to 10 times higher in the Midwest and Northern United States when compared to the West and Southern regions of the United States. It is, there's an estimated 15% of patients with Parkinson's disease who have a familial history of the disorder. There is also a common genetic contributor to Parkinson's disease, which is the LRRK2 gene, and mutations of this gene are seen in younger patients who also develop signs and symptoms that are seen in older adults with Parkinson's disease.
Ilana here talks about clinical manifestations, risk factors, complications, and diagnostics. So the clinical manifestations for Parkinson's is TRAP, not the song or the music you know, but you know the acronym. It's supposed to be a joke. Cool. So it's tremor, rigidity, akinesia, which is the loss of control of voluntary muscles, and postural rigidity. They can also have that blank facial expression, like that. They can have a slow, monotone, slurred speech, or they can have shuffling gait. It's not a 2-step, it's they're literally shuffling. Complications can progress, and they can worsen, and it can lead to neural problems like dyskinesia, dementia. They can have depression, which is more emotional than neuro. Obviously, they can, and if it does get worse and worse, it can lead to pneumonia. Diagnostically, there's no specific test for Parkinson's, so they have to base it off of the patient's history and their clinical manifestations, so it's really important as a nurse to look out for those things. And then the risk factors, age, it's usually middle age to late, male, sorry guys, it's on you. Hereditary, it's usually a 15% chance, so there's some leeway. And then toxic exposure, stay away from radiation. Don't do it, just say no. Thank you.
Hey, it's Uwa. Parkinson's disease is not contagious. It is not communicable, meaning it is not passed through direct or indirect body fluids and contact. Parkinson's disease is preventable with genetic counseling. And so what genetic counseling does is look for the risk factors and lets the person know if they have high risk of getting Parkinson's disease. Drug-induced Parkinson's can be prevented from medications such as lithium and Hadol, which are antipsychotics and mood stabilizers. They bring forward Parkinson's symptoms. So if the person could reduce the amount they're getting, or actually if doctors to just change the drug choice, that could stop that Parkinson's symptoms. Because Parkinson's has no cure, it is important for interprofessionals to care for the symptoms of Parkinson's disease. Treatment choices are medication, surgery, and diet. For drug therapy, Parkinson's is usually treated with levodopa and carbidopa, but for better treatment, a combination drug of both of them, which is called Cinnamon, is used, which converts dopamine to be used by the neurotransmitters. Benzotropines such as cogentine will help to block cholinergic receptors in the brain, which is very good. And Benadryl, which is an antihistamine, is also used to help reduce your cholinergic effects. Surgical therapy, such as deep brain stimulation, ambulation, and transplantation are usually done. For diet, food that are easily chewed and swallowed is what is preferred to reduce aspiration. And also, a caretaker or someone else can help to cut the food into little bite sizes to reduce aspiration. And if someone is taking levodopa, they should also reduce protein. They should limit their protein because it interferes with the drug effect. Financial burdens of Parkinson's disease for the patient, family, and society can be extensive due to issues such as health insurance coverage or lack of, unemployment or disability compensation, a need for home health agencies or rehabilitation care. And also, it's also very tasking to know when to secure power of attorney because of loss of mobility or cognitive abilities. Thank you.
It's Cotley. So Parkinson's can have an emotional toll on the person. It can cause them to have feelings of anxiety, frustration, or even embarrassment because they feel like they can't do the everyday things that they used to. They can also have depressive episodes with anxiety attacks. However, with a strong support system consisted of family, friends, or people who just care in general, and being well informed, these symptoms can be under control. Houston has rehabilitation services known as HAPS, Houston Area Parkinson's Society. They have things such as social services, support groups for families and patients, and they also have different rehabilitation activities. There's also a place known as Evergreen Private Care, and they provide home health services. There are also some support resources from Houston Methodist as well as Memorial Hermann, and these are the numbers up here, and we'll add everything down in the description box below. Thank you.